I'm going to go ahead and get started. So, good afternoon, everyone. I'm Jessica Gershenfeld, and I am the Social Services and Social Justice Coordinator here at YWCA Bucks County. YWCAs around the world are on a mission to eliminate racism and strengthen communities, stand up for social justice, help families, and empower women. Stand Against Racism is an annual campaign of YWCA USA designed to build community among those who work towards racial justice and raise awareness about the impact of institutional and structural racism. Structural racism impacts the ways in which people are born, grow, work, live, and age, as well as affects quality of housing, education, food, transportation, political power, and other social determinants of health. Understanding and addressing systemic racism from a public health perspective is crucial to eliminating racism and ethnic inequalities, which is why today we are going to discuss these disparities and ways we can work towards eliminating them. At the end of our panel discussion, there will be about 30 minutes for questions from the audience. We ask you to please put all questions in the Q&A and utilize the chat only for comments or to share resources. Keep in mind that we will answer questions in the order that they come in and can follow up with any questions that we may not have time for. We also want to remind everyone to be respectful of panelists and other audience members. Before we get started, we'd like to say a special thanks to Comcast for sponsoring this event. And with that said, I'm going to pass the microphone over to YWCA Bucks County's Executive Director, Guillaume Stewart, who will introduce our speakers and facilitate today's discussion.
Thank you, Jess, for that introduction. Good afternoon to everyone, all of our wonderful panelists. As Jess pointed out, this Stand Against Racism is a hallmark event for the YWCA. This is our 15th year of doing this event, and it really happens and takes place all around the country. YWCAs are reminding the community of the importance of racial equity, of equality, of women's empowerment. So we're super excited to be a part of this. And I'm humbled to be a part of to be the facilitator with so many incredible professionals in this field. In addition to Jess' point, I just want to point out that police brutality is a public health matter for people of color. And so we were excited as an agency. I was excited as a Black man. So many people, our friends and our colleagues, were excited to hear that George Floyd got justice and accountability by the will of the people, and the will of the people was aligned with justice. And so we're super excited about that, and we continue to just send good energy to his family as they go down this road of healing into the community and to our country. We stand behind that verdict, and we're excited about the verdict. We think it's a very important step forward. So I have the pleasure of sharing with you some incredible people. Now, as I was going through the bios of all these panelists, it was like reading a novel. So I can't go through everything that they've done. It's so long, but I encourage you guys to check these wonderful people out. But the first person that I want to introduce to you guys is Dr. Karen Hudson. Dr. Hudson is the program director for the homeless initiative at CHOP. Dr. Hudson is very passionate about that community, has done really important work around that, and we're excited to have Dr. Karen Hudson. Welcome, Dr. Hudson. The next person I have the privilege of introducing is Dr. Sharissa Gibson from Pennsbury School District. So we have one of our local school districts here, and we're super excited to have you. You're Director of Diversity, Equity, and Education, and that's super important. We're excited that you're here. That's an important role that you have, and we love the young people that you work with and want them to be a part of all the great work that we're doing. So we're happy to have you. Thank you so much. Dr. Ashley Stewart, we're also glad to have you. Welcome back. You were a part of another conversation we had earlier in the summer, but Dr. Ashley Stewart is the online coordinator and also an assistant professor at Temple University, the School of Social Work. So you're in good company. We have a lot of Temple alumni at the YWCA, so you're in good company with us. I'm excited to introduce to you guys, Danny, the Peace Center, this legacy that you guys have in the community, it really precedes you. And you have just added to that and just contribute to that. And we're so excited to have you. You are the CEO of the Peace Center right here in Bucks. And we're glad to have you. And thank you for being a part of this conversation. Last, but of course not least, one of my colleagues and my partners in the housing space is Aaron Lucas from BCOC. Aaron, welcome. I've always been a big fan of your work. Love your commitment to the community. Love the work that BCOC does. And I'm super excited to have you a part of this panel. So we want everyone to just relax. This is going to be a robust conversation. I was more nervous joining this Zoom because being with all of you, but because of how impressive you guys are. But I want everyone to just feel relaxed, and we want this to be a discussion. Very quickly, I'm going to point out something that's also important. Jess and I were talking about this and the staff over the last couple of weeks. A special shout out to all of our listeners. We have well over 100 people that are participating right now in this dialogue. And over the last few months, the community has really showed up around these important issues. And so we want to take this opportunity to say thank you to everyone that listens, everyone that shares, everyone that dialogues with us about social justice, racial justice, and women's empowerment. So thank you for that. Okay, here comes the tough part where we get to ask our panelists some really difficult questions, but questions that we think will serve a good conversation. So the CDC points out basically 5 determinants that are public health matters, and race comes into those things. And so each of our experts here today represent those various fields, and they're going to respond to these questions from their particular platform or their lens in the work that they do. And so the first question, because it's health related, will go to Dr. Karen Hudson. So, Karen, can you talk a little bit about the disparities that you see in healthcare around our country and in many communities, and how that impacts people of color? Dr. Hudson?
Sure. Thank you so much for inviting me today. I truly feel honored to be a part of this panel. And to talk about this topic, which is so important. Gee, thank you for also mentioning, the historic Chauvin trial verdict that came this week, because I know that is something that has been on the hearts and minds of so many of us. And even, from a health perspective, thinking about the trauma related to all of that, I'm glad that you mentioned that, because it's been a hard week, even with the verdict. But anyway, I'd like to sort of respond to your question with a few thoughts. So, to start with, I just want to say that some of the contributing factors that contribute to the health disparities for people of color include things such as insurance or lack thereof, transportation challenges, mistrust of the healthcare providers and healthcare systems, lack of knowledge about or the inability to navigate healthcare systems, role modeling, things such as using emergency rooms versus using primary care providers, are some of the things some of the ways that contribute to the health disparities that we see in the Black community. But now, at the core of all of these barriers, I just want to say, is discrimination and structural racism. Add to that thoughts of poverty, limited education, which often leads to health illiteracy, perhaps a fundamental disbelief in healthcare. There have been many research studies that have focused on discrimination and race, ethnicity, immigrant status, gender, sexuality, disability, and age separately and in combination. But most of these studies have focused on interpersonal discrimination, with less studies focusing on health impacts of structural racism or the accumulation of individual, interpersonal, institutional, and institutional racism, which all accumulate across institutions and systems. Now, I just want to break this down just a little bit further, thinking about this current environment that we're in. So Black Americans are much more likely to have high blood pressure and, increased medical issues like high blood pressure or kidney failure or diabetes than white Americans. And all of these medical issues and challenges make Black individuals more vulnerable to COVID-19, and thusly they are dying of COVID-19 at nearly 3 times the rate of white Americans. These health disparities are amplified by the threat of this COVID-19 public health crisis, the public health crisis and of the trauma of racism, and the police brutality and injustice that you mentioned, G. And I think the emotional and physical burdens brought on by this trifecta affects both the mental and physical health of Black Americans at alarming rates. So these are ways that I see that these all contribute and converge to contribute to the health disparities of people of color.
Thank you very much, Dr. Hudson, for that. I was told by my colleague Jess that I have to keep this short. I have to stay on my timeline because we got so much to cover. So she's like a producer and she's holding me accountable. So I'm going to move right to Dr. Gibson. Because the work you do in education is so important. Obviously, the young people in school is the future of our country, and the work that you're doing is so vitally important to the community. So can you talk about, from a education standpoint, what kinds of inequities and challenges do you see in that particular space?
Sure. And I'll start out by saying thank you. I appreciate the opportunity to be here and talk about these important topics, and as we're all doing in service to our community. And Dr. Hudson talked about a lot of barriers such as navigating systems and access, but she said the root was that structural racism. So I think that that's going to probably be a theme across a lot of what we'll hear on the panel. So I'll speak, of course, to that from the educational perspective. So I think kind of the clear and evident evidence of disparate outcomes in terms of education are that we see the results of structural racism in the sense of historical redlining policies and so forth, and how they have essentially contributed to hyper-segregated schools on a broad level. So certainly students of color and students from low-income backgrounds are hyper-segregated into schools where they are under-resourced and underfunded. And a lot of that structural racism in terms of housing policies and so forth really contribute to clear inequities in school funding. So, 75% roughly of school budgets are based on local property taxes. So when you have a school system based on the local wealth within the community, and then in turn, resources, personnel, and so forth are attached to those, there's going to be some natural inequity. And I think that's a common, understanding, but I think we need to also consider what does, how that racism plays out also, even within schools in well-funded communities. So certainly we are, I'm sitting here in Bucks County and we see some institutional racism within school systems that play out along similar lines. But what that looks like is opportunity gaps. That looks like internal policies or procedures that may intentionally or unintentionally continue those outcomes. So, if we're talking about tangible, visible evidence, it's the disparities in discipline. So students of color are disciplined at disproportionately higher rates than their white counterparts. Students of color are underrepresented in advanced courses and gifted education programs, but on the flip side, they are overrepresented in remedial courses and special education programs. So we see things, we hear often about the achievement gap, and that has to do with standardized test scores and disparities across students with disabilities, disparities by income level, and disparities that are predictable by race. So racism, both structural racism, those policies that are evident in our society, but also institutional practices within educational spaces also perpetuate some of that segregation, unintentionally perhaps, but some of our policies are unintentionally perpetuating those gaps. And so we have, I would argue, schools with a lot of internal diversity within a school system. However, students within those systems aren't always experiencing a diverse experience because of the way programs and procedures are set up, oftentimes students are moving even within silos within school systems because there are some practices that maintain those disparities.
Thank you, Dr. Gibson. That's really important information. I want to turn to Danny Thomas. As the CEO of the Peace Center, you do incredible work in the community. You're meeting with the people, you're meeting with folks in our community who have stake, who want to build a healthy community. Can you talk a little bit about how this topic that we're tackling today impacts your work and the work of your team at the Peace Center on a community level?
And Guillaume, thank you. And thank you all for inviting me. I was very intimidated also when I looked at the panelists, but recognizing that we all do join in this work together from our particular areas of expertise. And as the executive director of the Peace Center, we work a lot in our school systems, but we also do a lot in the community. So when we are talking about the society and community impacts of racial disparity, I like to share little tidbits, and we have to remember that racism is what has fueled and has fed the North American economy since our invasion by Europeans. And that if we look historically, when the economy appears to be sleeping or lagging, that's when we see the rises in racism again. And we can look, especially when the disenfranchised groups, the groups who should be at the bottom, are suddenly not doing as poorly as the dominant groups. So we see increases of racism, and that plays out in the society because you'll see the rioting, you'll see the violence, and you'll see the enacting of laws to push those people further down so that the dominant group can still remain dominant. And we have to look at the historical as well as the things that are happening currently, because as both Doctors Hudson and Gibson shared, all of that, though the redlining, the disparities in education, the segregation of schools, directly impacts the society in which the people live. So, Dr. Gibson specifically talked about educational silos. Well, those educational silos also mirror in the community in racial, ethnic, economic silos. And if we then pair that with our history, there's power in keeping people in silos. So we have to work at how do we get people to understand that all of us working together are absolutely vital to the success of the entire community, not just one component or the other. And Dr. Hudson eloquently pointed out COVID-19. If we think about who was absolutely essential to be functioning and working so that everything kept going, in this country, it was predominantly Black and brown people at the level of the basic necessities of lights, food, water, garbage. And yet we more celebrated the healthcare workers who were fewer and far between. They were absolutely essential, and they were also on the front lines. But they also didn't necessarily represent a broad spectrum, if you will, or color hues. So the disparities are there, and we have to truly recognize the value of everyone to every other component, just as the other two panelists have pointed out. And I'm not going to go on a long tirade because you've given us a time period. So I'll move to the next person.
Thank you so much, Danny, for that. Aaron, the work you do at BCOC is really important work. Dealing with poverty, we know that that's a serious issue that many people in our country is experiencing, and disproportionately people of color experience it. Can you talk a little bit about what you're seeing from your perspective as the CEO of BCOC, what that looks like for your work and where you stand?
Sure. First, thank you so much for asking me to be a part of this panel. You know, from the Opportunity Council's perspective, I just want to talk a little bit about poverty and then a little bit about some of the statistics for Bucks County in particular. We define poverty as the extent to which an individual does without resources. And I think that that's, you know, first and foremost, something that everyone can kind of put into perspective and think about, what are my resources? What are the things that I need to live a quality life? So let me go into some quick statistics. Bucks County has a population of about 618,000 people and a poverty rate of 5.7%, which is a fairly low poverty rate, 35,000 people. Goes up and down. Be interested to see how the 2020 census shakes out and what that brings to us, since it was in the midst of a pandemic, and things were a little different at that time, or a lot different at that time. So I said 5.7% of the population of Bucks County. Important to note is 16.99% of Latino people are in poverty in the county, compared to 5.24% non-Latino. In the African American population, 11.24% are in poverty, compared to 5.31% of white people. And I always like to, talk about, there's gender disparity as well. And so 19, almost 20% of female head of households are in poverty, compared to 3% of male head of households are in poverty. So it's important, information to think about. 12% of African American children are living in poverty in Bucks County, compared to 5.31% of white children. And this is, I think, also important to understand. The median household income for white households is $112,000. For Black households, it's $72,000. And for Latino households, it's $59,000. So the income disparities, come across very clearly right there in, black and white, very, very clearly. I think that something that's important is to understand a little bit about how poverty is measured, and that it's based on a very old resource that going back to a 1959 food survey that was done, and to get at the 100% of the federal poverty guidelines, or to develop the federal poverty income guidelines. Those guidelines are updated incrementally each year, a very small amount. So we see, adjustments in less than $1,000 a year in those. So to put it in perspective, a family of 4, mom with 3 children, 2 adults, 2 children in a household, the poverty level is $26,500 annually. So for a family of 4. And if you think about that, that's around $13 an hour. So a family of 4 cannot live on $13 an hour without safety nets, without subsidies. And I think that we hear so much about, the safety net programs, and that, it's welfare, and that there's two scopes. One is that it's incredibly insufficient, the amount of funding that is put into the safety net programs. And on the flip side, there are, people who feel like the safety net programs are a waste of money and are not helping anyone. And I think that, across the board, it's just important to understand that when you're hearing about poverty statistics, they're really looking straightforward at that 100% guideline of that number, and that going all the way up to 200% when, I shouldn't say that, 101%, someone is considered no longer in poverty. If you go all the way up to 200% for a family of 4, you're still only at $53,000 a year. And that is, 2 people working a $12 or $13 an hour job, or one person, working at $22, $23 an hour. And it's still insignificant. And right now we're talking about moving our minimum wage to $15 an hour. But what we know is that in Bucks County, that's still not a living wage. And so the importance of education and training and making sure that the safety nets and supports are in place so that people can move forward and can, gain the skills and training that they need to be able to gain a competitive job and a living wage job to support their household and support their family, I think, comes through.
Thank you, Erin, for sharing that. And I know that the Bucks County Opportunity Council, you guys are doing really important work around that, the economic challenges that we see. I want to turn now to Dr. Ashley Stewart. And Dr. Stewart, just have you talk a little bit about, from your perspective and the work that you do, about neighborhoods and built environments and how race impacts those spaces.
Yeah, thank you so much. So much about neighborhoods and built environments has already been discussed, right? We were talking about poverty, we were talking about redlining, we've been talking about the different zoning initiatives, we're talking about health. All of that is related to communities as well. So I'm really grateful and excited to be part of this panel to engage in this really difficult but important conversation. We started this off by, acknowledging the verdict of the Chauvin trial. And, I also have to acknowledge and honor Micaiah Bryant and Adam Toledo and Dante Wright. And the reason why I bring them into this space is not only because it's what's present and the forefront of my heart and mind today, but also the acknowledgement that these things are happening in folks' neighborhood. I'm here talking about institutional structural racism in neighborhoods and communities. And we must acknowledge that when we're looking at Trayvon Martin, we're looking at Philando Castile, we're looking at these horrific, crimes, they're happening in folks' homes. Breonna Taylor, right? This is happening in neighborhoods. And so this is just one of the different forms where we see structural and systemic racism play a huge impact. Yes, absolutely. I see someone, Nikki puts in chest, we must call their names and have these critical conversations about the impact of racism within communities. I think what I really want to focus on is the compounding aspect of it. And I think neighborhoods provide a critical example of the compounding part of the discussion. So we're talking about these structurally created, environmentally developed, human-made boundaries and barriers of how cities, suburbs, communities, rural areas, and the different ways in which people engage with their communities are developed. And so we can look at this as, we can look at it from physical health and say, okay, well, what kind of stores are accessible to people? Do people have access to nutritional food at affordable prices? Is there local farming that's available to people to have access to? Is there a higher prevalence of fast food? Is there a higher prevalence of corner stores, right, that are not able to sustain the amount of fresh produce or fresh food or fresh meat or whatever different sustenance that folks need? Are we looking at the higher prevalence of bars or liquor stores or things like that that are prevalent in certain communities over other communities? Are we looking at food deserts? And then we're looking at education. Exactly, yes. And then we're looking at education. We're looking at red line, right? Within my neighborhood, the lines are drawn so finely and so all over the place. I couldn't even tell you where kids go to school in my neighborhood because it's intentionally derived, it's intentionally developed. And so that is absolutely increasing and adding to disparity that we're seeing. And so when we're looking at how communities are developed, what are the different places and spaces that people can go for safety, for well-being, for health, for fitness, for worship, all of these things that are part of neighborhoods, we're really beginning to see, or we're setting community members up, particularly communities of color, to have this self-blame or this inflicted blame for some of these disproportionate outcomes, when really we're looking at a severe structural issue. We're talking about COVID-19 and the disparities around health outcomes, where we have to have a conversation about environmental justice. Are we talking about the fact that there are more plants and toxic fumes and chemicals in communities and lower income communities or communities of color? Are we talking about how environmental justice and more access to plants in urban cities is impacting the respiratory rates of communities of color? And if they're not living there, then maybe in the areas where people are going into work. And that's absolutely a part of this disparity. We know that in wealthier communities, there is not that same burden of environmental justice issues, which absolutely tie into and lead to health issues. And even when folks are in communities that feel safer, we talk about the compounding aspect of racism. That is, if you're a person of color navigating through these spaces, you still have the daily stress, the daily trauma of existing in a society where you're not exactly sure when you're safe, if at all. And so the reason why I bring this up, and I bring it in the framework, fortunate to be the last to kind of speak on a specific topic area, because I think when you look at what everyone else on this panel has said, you can see how racism's compounding. We can look at terms like allostatic load to understand how there is a wear and tear on the body as a result of chronic stress. And my area of focus is race-based traumatic stress. And if we know nothing else, that this is happening at exorbitant rates right now, but absolutely when we look at neighborhoods, when we look at ideas of safety, if we look at ideas of protection, when we look at ideas of nutrition, when we look at ideas of recreation, of education, all of those things are situated within neighborhoods, within the environment. And there's a structural component of that continues to perpetuate harm onto communities of color, and specifically with an emphasis of very poignant racial inequities that we see. So thank you.
Thank you, Dr. Storr, for that. Yes, I think that theme is coming through, that all of the panelists have touched on, that this is a large system that we're confronting, and we see it in neighborhoods and in environments. So thank you very much for that, Dr. Storr. Just want to say to all of our listeners, thank you for putting information in the chat and feedback in the chat. We will be having questions, and we want you guys to get your questions ready for the panelists. So we're going to move to our second question, and then we'll have one more after that, and then we'll open it up for discussion. So we're going to go in that same order. Dr. Huxon, can you talk a little bit about how communities can address these disparities that you talked about in healthcare? How can communities, I think all of our listeners are people who want to build community, people who want to transcend these challenges that each of you have been talking about. How can we do that as a community?
That's a really good question. And from the health space and the health arena, I would like to think there are a couple of ways to really think about doing this. One is language. How are we breaking down the language barriers? If people don't understand what health guidance and directions are being given, and we're not also checking their understanding about that, then we're going to see poorer health outcomes. So we have to look at and make sure that our policies reflect the ability to have potential patients and folks in these spaces understood by healthcare providers so that their healthcare needs can be addressed successfully. We need to also think about, who are our cultural brokers that are being the brokers between the healthcare institutions and the providers and the patients on people of color that are being served in our communities. One size certainly doesn't fit all. And I do think that we have to really think about what those that we're serving, who else is in their system that needs to be a part of the dialogue and understanding of what their health issues are. Both so that the healthcare providers can have a better understanding of that, but also so that the patients and people in the community can also have a better understanding of how to work with the recommendations that they're really being given, but work with it again around their cultural issues, practices, and things that are just important to them. I think it's also important to think about the healthcare providers and how we train them around implicit bias and, you know, understanding who they are and what they're bringing to these healthcare encounters. And I'm really thrilled to see that more of that is happening now than has happened in the past. And I think that that's just essential to really help effectuate, you know, more successful health outcomes for folks that we're serving. I think we should also be thinking about taking healthcare outside of the walls of these large healthcare institutions and really taking it to the community, you know, meeting folks where they are. Meeting people where they are and trying to help them from that space. And that means, again, breaking down the fear of not wanting to go out into the community. You know, that's where you're going to better understand the patients and the folks of color in these communities that we're working with. And so if we're really committed to their healthcare, we sometimes really do have to get out of our spaces. I think we also need to be thinking about things like healthcare navigators. Who are the folks that can help the communities of color understand these large systems and navigate all of the complexities around scheduling, around what this particular health care provider does versus what another healthcare provider does, and to just be the broker in terms of helping to understand what the needs are and the desires are of the folks that we're trying to serve. So I think that all of those are a part of ways that the healthcare system can be responsive to these needs. It's the development, again, of just different policies that are going to make healthcare provision more accessible to people. You know, what kind of free services are we providing? You know, what kind of policies are there in place to help people get coverage that don't have coverage? So I think that there's a lot of work that can be done and is being done in this space. And those are the kinds of things that I would suggest at this point.
Thank you. Thank you very much, Dr. Hudson. I know you're doing important work in that space through your work at CHOP, and I think that's really important. We want to move now to Dr. Sharissa Gibson and just talk about, from education, what can we do as schools, as counselors, as teachers, concerned parents? What can we do in the space of education to combat these challenges?
So I feel like I'm going to continue to follow Dr. Hudson and reiterate a lot of the similar concepts, because I do think that the approach is probably similar across the various areas, but it's that kind of dual capacity approach. It's focusing on building, learning, training, and capacity of people who are in the systems, and then looking critically at the policies, practices, and procedures within the systems to make sure that the barriers that exist are identified first and then removed. So, you know, I think both within the school walls and in the community, it's about recognizing, being self-aware. It's about recognizing our own identity and being cognizant of that racial identity and how that identity is present and shows up in all of our interactions. And I think, you know, traditionally it's been easier to take that colorblind approach because, you know, we're talking about equality. And so my position is Director of Equity, and what I've tried to do for our school community at large is explain that both equality and equity are required, and they don't work in opposition of one another. But, you know, we talk about equity. Equity is the process and the steps to get to equality. And we know that right now, the outcomes for students are, we've taken in the past a colorblind approach, but I heard I didn't make this up, but I like the way it was said but there are color-coded outcomes. So that colorblind approach isn't sufficing. So the idea is, working to identify and understand and recognize your own identity and how that shows up in your interactions, and recognizing that your own experiences and perspectives are not universal, and that somebody on the other side of that experience isn't experiencing the system the same way that you are. And then as educators within the system, we have a responsibility to be cognizant of our identity and how it shows up, but then to look through a cultural lens or an equity lens at our system practices, at our policies, at the way we deliver instruction, at the way we decide which students get into which groups or classes. All of those day-to-day educational practices really need to be evaluated through a lens of self-awareness if we're going to really address those disparities that are perpetuated. I mean, without taking kind of a different lens on our old practices, we're just going to continue to perpetuate the outcomes that we're having. And I think in education, I think there has started to be at least a shift broadly, because we're recognizing that our traditional systems are not working for all students. And I know that, I say frequently, we all as educators come into this space wanting students to learn, all students to learn. The problem is that our good intentions haven't always matched the outcomes that we're seeing in the system. So let's not make it, personal. It's not a no blame on individuals within a system, but there is a collective responsibility to help all students move forward. And so I think it's that two-pronged approach of building the capacity of people to understand their role and their identity and how it impacts outcomes, and then looking critically at our practices, our institutional policies, to make sure that they are really yielding the outcomes that we intend for them to yield.
Thank you so much, Dr. Gibson, for sharing that critical point. What can we do, Danny, as a community to fight this injustice, to fight social injustice that we're seeing? What can we do?
The biggest component of that is recognizing that racism really is the bookends for all of the other isms and issues that we may be facing, at least in a North American context, and going from there to understand that, I'm actually borrowing this, so Dr. Hudson, yeah, I didn't create this either, but you have to look, if there's a dead fish in the lake, is it the fish's problem, or there's a bunch of fish? I borrowed this from the Racial Equity Institute out of Indiana. And then you might have to look to see if the spring itself is poisoned. So I think for us getting a larger awareness of the systems and then educating, and Dr. Gibson, thank you for pointing out that we need to move beyond being colorblind, because someone put in chat, it isn't one size fits all, and that is absolutely correct. It's not one size fits all. And yet, as much as we want to pretend we're colorblind, we're not. And we all see it. It might, we talk about implicit bias, that's because it's somehow baked in. And we have to get beyond that. And I just want to share this example with folks. You see 4 kids of color on bicycles riding down the street. One of them has a baseball bat and they're yelling across to each other. And you might notice one of them has something that looks like a glove. And you watch them ride off. Think about what you're feeling now. And now think about, you see a group of 10 white kids on bicycles riding down the street, yelling to each other back and forth, and 5 of them have baseball bats. Do you even look to see if they have a glove, or do you say, wow, they have enough kids to actually have 2 teams? You know, that's the sort of biasing in communities that we have to be aware of. How we view our kids, what safe space looks like, and understanding that racism really does determine how one may feel safe in a community. And I can't remember who it was that spoke about the inherent, actually it was Dr. Stewart, the ongoing trauma that every killing of a person of color takes me back to when I was 16 years old, the very day I got my driver's license, and was pulled over by a cop who pulled his gun. You know, and many years past that, but it's that recurrence. So what does that do long term? So when we become more aware of all of these components in our lives and in other people's lives, we have a better opportunity to address it. And when we look at racism, you know, we love to talk about it in wonderful scientific terms as far as issues. And we like to deal with it objectively, but I challenge us to also handle it subjectively, recognizing that you are talking about real people, real lives, real situations, real families, and real outcomes. And to borrow from wherever Dr. Gibson borrowed it from, those outcomes really are color-coded still. And we have to be able to dismantle that. So it's really about community awareness, keeping your eyes open, and then being able to educate yourself, and then the willingness to be an upstander when you see something's wrong. The Peace Center tries to stay non-political. We will talk about bad policy, but we don't demonize politicians, because you don't make peace with demons. You try to work to resolve the issues. So, but I do encourage everyone to look at the policies and the politics, and then vote. Vote such that resources are equitably distributed, such that the poor communities don't get the bulk of the waste treatment plants, and so that everyone has access and opportunity.
Thank you. Thank you so much, Danny, for that answer to that question. Aaron, as you think about this from your space, can you also talk a little bit about what the Opportunity Council is doing as an organization to reach some of these issues that we see? I think you guys are doing really incredible work. Can you share that with our listeners?
Sure. I think first I want to share, you know, some things about what community can do, and then I'll talk about BCOC. We really look at, you know, that there are 2 different kinds of resources. There are getting by resources, the resources that, you know, help people meet specific needs and help them cope in poverty. And then there are getting ahead resources, and they're the ones that help people build wealth. And so what communities can do is, you know, help people build those getting ahead resources, make sure that there are training opportunities, educational opportunities, employment, living wage employment, that there is adequate transportation in communities, that there are childcare resources, that there is funding for school districts, as Teresa shared, that there's adequate funding for all the school districts, not, you know, some school districts having extreme wealth and other school districts being very under-resourced, that there are childcare, that there's funding for childcare, but that there is also, I think that people need to look at childcare as a temporary thing that families need, and that it is something that prevents families from entering the workforce when they're unable to afford. It is also something that sometimes keeps people in jobs that are not providing sufficiently for their family because there's not after hours childcare, or there aren't adequate resources for them. So thinking in terms of, is there a way to, change policy or change the way we distribute funding for childcare organizations so that, we can help more people? There's so many people in that income gap of their, not considered in poverty, but we know that they are definitely not in the space of being able to build wealth, and they're not in getting ahead resource area or territory. Improved lending practices to address home ownership disparities. There is, so many families that we meet at the Opportunity Council who want to be homeowners, but they haven't had the ability to save up enough income to be able to have a down payment. And creating some additional homeownership opportunities, that's typically how most people build wealth, is, buying their first home and buying their first property. And it is definitely, there's definite disparities in people's ability to buy homes. And I think that, improving some lending practices and or creating some programs to help people get to home ownership faster would be definitely beneficial. I think we can support income equality through programs, and some of the Opportunity Council programs. We run the Volunteer Income Tax Assistance Program, VITA, which is a free tax preparation program. But what that does is help people file their taxes, but maximize their refund, their tax credits, and get the most money back in their pocket without spending, money on, I'll say, the predatory lending practices of some of the income tax, we'll do your taxes today people that charge exorbitant amounts of money for an easy tax filing. Scholarship programs aren't enough. I think that what often gets missed or forgotten about is that there's lots of money for scholarship, lots of money for educational scholarships for people to go to college. But many kids in poverty who receive educational scholarships drop out in the first year. And it's not because there's not money for the education, but it's because there's not money for the rest of the things that are needed. Or there's a pull for them to go back home and help support their family who is not living well while they're going to college. So figuring out, are there other opportunities to be able to support the basic needs of students while they are in college, and looking at it that way. On-the-job training opportunities for families who are getting back into the workforce, apprenticeships, non-traditional workforce opportunities for single moms or single parents, long-term solutions like our economic self-sufficiency program, which is, a one-on-one coaching program. It's really an individualized approach where we kind of take in all aspects of what is it that somebody needs, and then we try to put all of those safety and security things in place, so that those support things in place so that people can achieve their goals. And I think that, again, I'm going to hammer on the importance of the safety net programs. I think there's such a huge argument back and forth about, whether or not we need those and, how important they are. And I think that they fill the gaps while people are working towards self-sufficiency. They also help people who are unable to, provide basic needs. And I think that without those, without food and housing, kids aren't able to engage in school. And so those are just really important. And then the last thing I'm going to touch on that communities can do is affordable housing options. Municipalities need to stop blocking developers from creating housing options for families with lower income. We have that in Bucks County. That is, I'm sure that happens in a lot of counties, but it certainly happens in ours here. And I think that, that is a huge barrier for people to be able to move ahead and to live a quality life, is that there is not adequate affordable housing. And as we're in the housing space together, that this is an ongoing thing, and communities really need to work on that to do better.
Absolutely. 100% right. Thank you so much, Aaron, for that. Dr. Stewart, can you talk about that in terms of neighborhoods and built environments? We do that, we're in the neighborhoods through our programs and services. So this is really critical. Can you speak to that?
Yeah, so one of the quotes that I like to go by is, "We cannot challenge what we cannot acknowledge." And I attribute that quote to Dr. Kim Crenshaw, but someone said that Dr. Phil said it. I'm not sure. I'm sure a lot of people have said it, but the premise of it is at the base of it is that the first step to challenging, a lot of times folks want to move straight into action, but there is so much that goes into this. Someone put in the Q&A that racism takes work to remove stereotypes, prejudice, and biases from one's thinkings, vocabularies, and reactions. Right? How do we begin that process? And so I'll do a lot of trainings, particularly trainings around services that are being provided in neighborhoods and communities, and people want to go straight to action. And it's like, well, we need to recognize that assessing folks' biases, our lack of comfort to even be able to talk about race and racism, the fact that most of us don't even have the historical knowledge about how race and racism come to exist, particularly in the US, it is part of that action that needs to be taken. People don't know this. And so, there was another question too about like a big barrier being, or someone made a comment, but they made it just to the panelists, that a big part of the barrier is that people are afraid that by moving forward or making racially equitable change is going to somehow compromise or jeopardize their lifestyle. Now, this can be easily seen in a lot of the research that's been done around like affordable housing. So they'll go into communities and they'll propose affordable housing, and people will say, absolutely not. Like, no, we don't want affordable housing in our community. And then they'll be shown pictures of what is being proposed for affordable housing or subsidized housing in their neighborhoods. And they can't tell the difference between their neighbor's house and the subsidized house, the affordable housing homes. But yet there's something in it. There's that internalized, implicit, explicit biases that persist, that people have these ideas around what does it mean to have affordable housing or to have subsidized housing in their communities. More so than that, it's also about what we see as like a white dominant culture, about what is good, what is safe, what is appropriate, right? And some of the cultural dynamics that we'll see in communities of color and see in neighborhoods are already being marginalized or ostracized or, feared. When it's a celebration, it's music, it's laughing, it's different cultural variables about how people navigate. It's people speaking in their home language that in some way, shape, or form, if you are deeply rooted in white dominant culture, can feel like a threat to you. Well, that's your work to do. That's your work to begin to assess. And so a lot of times I have the opportunity to work across all spectrums of what do we do. That is going into communities, increasing people's awareness. That's training and helping people assess their biases and stereotypes and their prejudices. This is having the conversation and the educational knowledge about what is race, what is racism, what are the different levels of race and racism, what is the compounding aspect of racial trauma, and how does that affect the neighborhood and the communities and the ways that we occupy our roles as individuals. We should all be assessing how we perpetuate cultural imperialism in the work that we do. If you are in a community, you're building community organizations, or you're an architect and you're looking at structural building, if you haven't done and assessed your biases about what the neighborhood needs, you do not need to be building or creating anything. I live in I grew up in a community that was a predominantly white community, but when there was a major flight to have white families in the cities, and the cities became more booming, it became a predominantly Black community. Well, the folks who were part of the board of the township decided that they were going to make informed decisions about what would be best for the communities and closed all the pools and turned them into basketball courts. I think that's such a pervasive example of how people go into these roles with their bias, their stereotypes, and their cultural imperialism and project it into the work that they do. And so when we get to that more actionable state of like thinking about what to do, people don't want to give up their power. But what I would tell folks is use your power. Use your power to create a different role for yourself. If you're on the school board, if you are on the neighborhood, you're running for a local office in a particular community, perhaps your power is creating a different role for yourself to create space for someone who has a different set of skills and knowledge that is relevant to culturally appropriate, culturally adaptive, understanding of multiculturalism, understanding of anti-racist practices, to step in the role and do the work that you might not be able to do because you're still doing the work of critically understanding what anti-racist practice is for yourself. It's still an act of power, it's just shifting it. And I think people want to hold the power that they have and they want to implement little task force to try to change a system. But we really need to commit to culture shift at this point, which means that things have to change and people have to begin to move around and things have to be thought through in a completely different and innovative way. And so maybe some of those more actionable, tangible things that could shift are people reconsidering what their role is in addressing some of these disparities.
Thank you, Dr. Storr, for that. I'm told that we have a lot of questions. These comments, all the things that you guys have been talking about, we have some pretty hefty questions. If it's okay with the panelists, can we just move to the questions from the listeners? Is that okay with you? Thank you so much. So I'm going to ask Jess. I know she's here. There you are. She's going to take over this part of the discussion. Jess.
Yeah, and I think not getting to that last question is okay because I think through answering the audience questions, it'll probably come up. So I think that's all right. So the first question that we have is racism takes work to remove stereotypes, prejudices, and bias from one's thinking, vocabulary, and reactions. What do you recommend we do to begin this process? So I'm gonna leave it open to whoever wants to, give their input because it's not directed at anyone specific.
I want to jump in and do that plug because that's right up our alley in Bucks County. Because the Peace Center has programming in 11 of the 13 school districts. And the programming ranges from kindergarten through high school and covering topics beginning with just the kind of awareness of difference, kind of a self-esteem, cultural awareness, valuing difference. Then we move into other programs as the kids get older. So education is key to that. Within the organization, we have two separate directors in addition to our director of relationship development. Our director of educational programming, Kate Whitman, covers anything related to schools for the most part. And then she is joined in many instances by our director of community programming, Gail Evans, who does the bulk of the heavy lifting around racial equity, diversity, inclusion, cultural humility, because we don't like the term cultural competence because that's white people mastering other people's cultures and saying, okay, got it down, let's go to the next one. So really it is that educational component, building it in early and often, and then reinforcing it even in adults and definitely driving it through organizations. Right now, the ground is fertile because suddenly everyone woke up after the murder of George Floyd and wants to appear on the right side of a decision. So we have to make sure that we keep that momentum and that education going. Okay, that's my take. Go for it, someone else.
Thank you.
I think there's an assumption that at some point people will learn this or get this information. I think we need to challenge that notion. If you are interested in, for folks to take accountability to do their own work, we wait for it to be part of our job training or part of our curriculum in school or part of a book club that we're going to join at some point down the road, and we defer. But the reality of it is that the work to become anti-racist, the work, it's an action, it's not an identity. And so taking that accountability to start that process of saying, okay, well, what are my prejudices, my biases, my stereotypes? What are the things that I don't know about? What are things that make me uncomfortable? And how do I lean in to those spaces to begin to challenge myself as part of my own professional growth and my own self-awareness?
I just want to underscore what you just said, Ashley, because I think it is all of that. And it is, again, people have to understand this is a process and it's a journey. One course, one training is not going to, make you proficient at any of this. And this is really not about trying to be culturally competent, as Danny said. We'll never be culturally competent, whatever that means. What we want to do is get to a place where we can be culturally effective, so that the work that we're doing is effective. The health outcomes that we are seeking are effective. The educational outcomes are effective for the lives of the people that we're serving. And so again, I have been a social worker for the past 40 years, so I am not new to this. But what I'm seeing these days is there is so much more conversation going on in this space around race and diversity than I've ever seen. But my question is always, but how sincere and authentic is it? Are people really just showing up in these places and spaces because out of curiosity, or are people seriously wanting to do something about changing who they are and therefore what their contribution is to the solution? I'll stop here and let somebody else comment.
I just would echo a lot of what's already been said. I think the process, journey, however you want to describe it, and I think the fear, of course, is that it takes incidents such as a public incident, because we know that's not a new occurrence. That's just the circumstances allowed everyone to see what was taking place with the murder of George Floyd. So the fear, I believe, probably is that it's about a response to an event or a moment, and that there's no longevity of the real shift towards really engaging in that self-reflective process that needs to happen in order for sustainable change to occur. So I do think that it's about Dr. Ron Whitaker, who's an educator. He's incredible, but he has something that he's done called the HELP framework, and it's an acronym, and the H stands for history. And I think it was Dr. Stewart a few minutes ago who talked about people want to jump to education. The P in his framework stands for practice pedagogies, because it's an educational framework. And people want to jump to, he says, the P. They want to know, like, okay, what do I do in the classroom? And the premise of his framework is, well, you got to start with the H. You got to start with the history. You have to understand the impact and the presence of racism and the historical context in order for that P to be effective. And I know we're not there yet, but I saw a question in the chat relative to curriculum in schools. And I know one of the panelists, I can't remember who, brought that up. It's ongoing. It is not a single, course. It is not a single unit or chapter, and it's not a single professional development for faculty and staff. It has to be embedded into what we do as a system ongoingly, so that, the action or the practice. So like, here's the thing. If we change curriculum now, do we have teachers with the capacity to deliver that curriculum with fidelity in a way that won't be just as harmful to students? And so it's a messy process, and it is a journey, and it requires ongoing professional development. And then again, that reflection piece, because we have to reflect on our curriculum materials and say, are they representative? Are they showing multiple perspectives? Are we questioning whatever comes across in a textbook through critical thinking and the socio-political context? Are we asking questions about power and oppression as we go through whatever those materials are? So it's a messy process, but I think, again, I find myself echoing the others on the panel. It has to start with like your self-identity, developing your lens, because you can't, your actions are going to fall flat in a sense if you really haven't seen what is needed in understanding the perspectives of those who have been marginalized.
Thank you, Dr. Gibson. I think, Erin, did you have anything that you wanted to echo before going on to the next question?
No, I definitely don't think that I could share anything better than everything that's been shared.
Okay, so I think Dr. Gibson covered the next question a little bit, that you saw it about the education. So I'm going to go on to the next one. We have, how can we celebrate our identity when even this week, a young man in Texas was suspended from school over his braided hair? He is 11 years old, biracial, and wanted to honor his Black heritage. It resembled a man bun, which is against school policy. So I know I did see some talk going on in the chat about this question. So if anybody could just touch on it quickly before moving to the next question, that would be great.
Dr. Stewart, go ahead. I mean, I feel like I'm under fire for this one because it's education, but I'll just say that, you know, that's absurd. There's no way that something relative to a student's identity, culture, or heritage should be a part of anybody's discipline policy. That I don't have anything real profound to say about that other than discipline policies. You know, it's about norms, right? It's about who has cultural capital, whose norms are discipline policies based on, and you know, who's being affirmed and who's being disadvantaged based on the way those policies are applied. I'll turn it to Dr. Stewart. I'm gonna stop.
Dr. Gibson, you couldn't have said it, you know, I was gonna share this similar sentiments. You know, it says a lot that someone can look at braids and think that there's something inherently or possibly wrong with it. Like, that in itself, we're not even leading with a space of humanity. So in the chat, I put a little bit of research, but I know everyone's not watching the chat, about the Crown Act. And the Crown Act is basically legislation around anti-discrimination in work in schools, about how people's hair shows up. And you know, we're talking about Bucks County. Pennsylvania has not passed the Crown Act. Like, it is still technically there's no protection against people being discriminated against. And Texas also did not pass the Crown Act to protect people from being discriminated by how their hair grows out of their head. Like, the pervasiveness of racism, if you are exhibiting or occupying a space of privilege as it relates to racial and ethnic identity, you might not even think about it. But the reality of it is folks of color are always thinking about how we show up and what our hair looks like and how we might be treated accordingly to that. And that is part of that allostatic load that I was describing earlier, that compounded stress. Because yes, our children could be suspended from school from wearing their hair how it grows out of their head and in protective, healthy, beautiful styles that are just a natural part of our cultural identity. So 40 states to go to acknowledge hair discrimination.
Would anyone else like to add before I go to the next question?
No, because I love my braid. I've been doing it for over 20 years.
I think it's just absurd. Like the thought that someone would, a child would be sent home for for having their hair in any way. It just seems absurd, especially when, aren't we worried about them getting an education, and being sent home certainly is not serving that purpose at all. So it's just absurd. Hopefully Pennsylvania gets on it. So Ashley, we all need to talk to our legislators about getting that passed. Yeah.
Did want to share. Go ahead. Dr. Hudson, you were going?
Oh, no, I wasn't. I'm sorry.
Okay, I did want to share, sometimes it's cultural in the community you find yourself, because why I started the braid was I worked in East Africa and I had dreadlocks, and I was having problems with maintaining that. But I also had people informing me that the work I was doing, dreadlocks were inappropriate in a Christian context. So you have to undo a lot of that historical teaching. And I would have to challenge some of the folks to ask them, do you understand why the colonist said that Africans shouldn't have their hair natural? It was so they could tell you apart who is part of the church community and who isn't. So who should be in and who should be out. And then it becomes a cultural norm. So it goes back to what Dr. Stewart was saying about, history and undoing some of that. And we have to look at that in this country, in all of our communities, because it may not be explicitly spoken, but it may be there as an implicit response and reaction.
Thank you, everyone. So the next question says, hi there. I've been in situations where I've dealt with people with subtle racism. I didn't have the knowledge to correct them. I just got mad and didn't know how to respond. Examples included somebody calling Black children on bikes monkeys, and someone telling me that Black people should be over slavery because it's been 200 years. How can I educate those people who were friends in what's right? I understand that some people like to linger in their ignorance, but I feel I should try to stand up and support the Black community. And if it's okay, I would just like to say one thing about this. First, I think, and we've talked about this throughout the whole session, is recognizing where you're at. So recognizing, what you know about racism and educating yourself, and then sharing that knowledge with these people who you're finding are lingering in their ignorance, and using your voice. So if you are hearing these terrible terms being used, don't let it go. Don't, it's uncomfortable to confront, someone who, I'm the least confrontational person, but that something that horrible just stings your stomach, and you can't not say anything, because even if, you could say something and they might not get it in that moment, but down the road it might hit them. And I think not saying anything is just complacent and worse. And I'm sorry to take over, but please, anyone feel free to add in.
I'll just quick say, I think about this in terms of this idea of like assimilation, right? So assimilation is about people from diverse backgrounds, so racial diverse, whatever difference and otherness you feel, needing to kind of leave some piece of yourself to fit in, right? So whatever that nudge is, you got to fit in whatever that society is. So if we're talking about hair, I'm gonna pull my hair back when I come to work so I don't get like 20 questions, like whatever that assimilation piece is. But I think about, as you're talking, regardless of who you are, white, Black, Hispanic, and otherwise, if you hear a racist term, I do think our society places this like subtle assimilation on people who want to be upstanders, right? Like you're like, it's almost socially like, why are you making the issue out of this? So like, there's that like, I just think that fear to speak up, right? We have to think of that also as the way that this system of oppression and racism continues to perpetuate itself, by that idea of silencing people who feel that, I feel discomfort. How do I respond? Should I respond? Well, I think we would all agree the answer is always yes, but it's about the stress related to the system kind of pushing back against, like, you should stay out of that, or you should, why are you creating a problem that doesn't need to exist? And I don't know that that answers the question per se, but that's just what I'm thinking about as people who kind of struggle in the presence of the moment and under that racial stress and decide to be quiet. It's almost perpetuating the norm of such negative comments being out there and not being challenged.
Mm-hmm.
And I would certainly agree with that. And I think also, let's go back to recognizing that all of this conversation is difficult and can make you uncomfortable. And it should, if it's really going to help you grow and help others that disagree with you grow as well. And I think that, you know, you do have an obligation to either to make a choice. Are you going to sit on the fence, or are you really going to be a part of the problem, or are you going to be a part of the solution? So are you really going to say something, speak your mind, be an ally or an accomplice, you know, and get into good trouble? Like, really, that's what it's going to take to change things that we're looking at. And so, again, I think that we owe it to people to use our voices and to honor the opportunity to make some changes. But we're only going to do that the more of these conversations that we can participate in, the more that we can practice how to be in these hard conversations, but be in them nevertheless. I just think that that's critically important.
Dr. Hudson, thank you, because actually the first time I met Guillaume, we were in a meeting and we were all just talking around the subjects of how to prevent outbreaks of violence in Bucks County. And it takes someone to say, let's get okay with being uncomfortable, because it's not about developing so that one group might feel comfortable at the expense of others. So let's all be uncomfortable together. Let's have the conversations to move forward. The Peace Center started out as a conflict resolutions organization. You know, my specialty is mediation. But the reality is I was a science geek before that. And if we think back to our basic science lessons, you need friction for motion. You know, if your car's on ice, you throw the kitty litter under the tires. But it's up to you if you decide you're going to put the car in reverse or in forward, and which way you're going to go when you move. But friends, we have to be willing to go through the friction for the movement to make any progress. No one wants to get up from the comfortable easy chair or recliner. So getting comfortable and then getting proximate. Okay, Dr. Stewart, I can see you want to come on in there.
No. You know, I'm resisting the urge because I don't want to repeat things y'all have said so many jewels, and just like on this particular conversation, this is one I engage with a lot. You know, unlearning silence is a way to maintain comfort. You brought up that point, Danny, about you know, about the discomfort is inevitable. And so if we lean in and say, okay, the discomfort that I have with addressing this is a glimpse of the discomfort of the folks who are living it. It's a glimpse of the discomfort that child is experiencing, knowing that there is a society that perceives them that way and treats them that way. You know, it is just a small amount of our courage that we exhibit that is displaced for the communities who are experiencing this day in and day out. And like Dr. Hudson said, we have to just practice it. It took courage to ask that question, and the next time it'll be easier. And it's the same with saying something or doing something, like Jess was saying. I tell my students, the first time that we develop the courage to say something in the moment is often not the time when we need to. And so it's about being prepared and saying, all right, I missed that opportunity to address it then, but I'm going to get myself ready so that the next time I have something to say, and always being able to go back and revisit. I'd call those friends back and say, you know, you said something a while back ago, and it's been sitting with me ever since. And I don't know if you meant it that way, but that was really like, I'd go back. So just some thoughts. I don't know who sent that question, but definitely sending you strength and courage and being able to address things like that moving forward.
Thank you all. So we have 5 minutes left. I would like to ask the very last question in the chat. And I hate to only allow one panelist to answer, but if there's anyone that has a a burning, actually, it's directed towards Dr. Gibson. So that's actually a good thing if we can stick to that. So Dr. Gibson, how do you see health inequities manifested in your students? People tend to think of Pennsbury as a well-resourced and healthy school district without recognizing the racial and class diversity within it. So how do you see those health and inequities within those silos that you spoke to?
So I think the silos, and I think we see it in Pennsbury, but it's not unique to Pennsbury. So I'll speak kind of in more broad terms. I think the silos in race, economic status, it's really a product of a lot of what's been discussed. I think back to the first question when we were talking about where we see racism in our various areas, but I think the students come in from neighborhoods that are already segregated, whatever that looks like, not specific to Pennsbury, including Pennsbury, but they come in from neighborhoods that are segregated, whether that be by economic status or race or whatever that opportunity gap might be. And then they come into our classrooms and they sit with similar peers. They become friends with those peers and they go throughout their school system with those peers without a lot of intersection, right? And then they go out into the community and they get jobs and their social circles, always kind of maintaining these parallel, if you will, experiences that don't necessarily intersect and allow them to really experience the diversity that might be walking right next to them in the hall. Because Dr. Beverly Daniel Tatum, it comes to me right away, the book, Why Are the Black Kids Sitting Together in Cafeteria? Her research is, it's true, you know, across the board, students are going to end up in social circles sitting at the cafeteria together with peers who kind of they identify with in terms of their racial identity, in terms of that feeling of belonging. And so if we're not intentional about creating spaces focused on unconditional belonging across, you know, identity factors, then I think students will continue to kind of live these parallel experiences in our schools. And then that, I believe, turns into separate but parallel types of experiences that don't intersect through social circles and who you're on the extracurricular team with, whatever that looks like in our communities. And then that translates into jobs and careers and so forth. And I don't know that that speaks specific to the question, and but that's kind of what I imagine as that silo approach to what does happen and maintain in educational settings.
Thank you. And we are coming up on 1:30, and I know that I'm sure everyone has to get back to work or back to their day. I think we could probably talk about this for a lot longer and share more resources and, you know, keep it going. But I am going to let G do some final words and just thank you to all the panelists and thank you to all the attendees as well for being a part of this.
Thank you, Jess. Yeah, I just want to echo what you said. Thank you to all the listeners, everyone that signed up in the community to be a part of this important conversation. Thank you to our panelists. Each of you, all of you added so much important work. We look up to the work that you do at your organizations, and we want to stay connected to you in the work that we're doing here in Bucks. I would also like to just say thank you to Comcast again. I know Jess had mentioned that for sponsoring this event. So we're really grateful for that support. And I want to shout out, lastly, the YWCA Bucks County staff who have been on the front lines of this kind of work and really excited to collaborate with people to build better communities. So shout out to everyone at the YWCA. Yeah, that's right there. I'm super happy to see how hard they work around social justice and women's empowerment. And it's just humbling to be a part of such a great team. So having said that, Dr. Hudson, thank you so much for your contribution. Dr. Gibson, thank you so much for your contribution. Dr. Stewart, thank you for your contribution. Aaron, my colleague in the housing space, thank you so much for your contribution. And Danny, a fellow nonprofit person, thank you so much for your contribution. And to everyone, have a good rest of the day and thank you.